our quality improvement project on decreasing new patient intake time. So what does that mean? So our current state is with problems regarding new patient appointments. New patient comprehensive exam appointments, as we know, tend to run late due to a number of reasons, one of which includes the new patient forms that require extensive patient time. Now currently there is some ambiguity in the system in what we tell our new patients when we are booking them. They're either asked that one, come on time to the scheduled appointment time, or come anywhere between 15 to 30 minutes early to complete their new patient forms. Unfortunately, this can be a problem when patients don't arrive early or even come late to their scheduled appointment time, because the patients still need to complete new patient forms, and then that causes delays in our time, and then that cascades down the line in our scheduled delays. So our current state is that we don't have a clear protocol exactly for when new patients are expected to arrive to campus. This oftentimes impedes the provider from starting the new patient exam on time. Delays in the provider schedule can add to clinic stress and a lot of other variables that we may be well aware of. Delays in provider schedule can lead to delays in other scheduled appointments. Like I said, this cascades down in our appointment schedule and also affects other patients that may or may not have arrived on time. So our overarching aim is to decrease delays in starting new patient exam appointments and by ensuring timely appointments without delays attributed to the new patient form completion prior to these appointments. So providers will seek and initiate new patient exams within 7 minutes of the appointed new patient exam time, which is the scheduled time for their appointment to start.
So some of the root causes of the issues in the clinic right now that involve the patients is that the patients are either not coming on time, they're not coming early if instructed, or they get lost, especially here due to traffic. They come here late. New patient forms often require a long time to complete. Patients have extensive medical histories, and the patients have to do that while they're here. Some patients don't have access to email or printers, so even if we email them the new patient forms, they wouldn't be able to complete them. Some of the root causes that involve rules, policies, or procedures are that late policies are not followed, so even if the patients arrive 25 minutes or more late, they're still given the new patient forms to complete, and that means that we're starting our appointment with like 10 minutes left. Another thing with rules and policies is that depending on who's asking the new patient to come in, they might tell them to come in early or not, so there's no uniformity. Environmental root causes would be not wanting to waste paper, envelopes, or stamps, and that's also a financial concern. No? That's what I was told by Esme.
By whom?
Esme.
Okay.
Um,
I'll talk with her.
okay.
There's no such a thing.
Regarding staff, staff are unaware of the time that they're supposed to request the patients to come. Staff are hesitant to ask for emails or addresses, or to have one more thing added to their list of things to do when they're making a new patient appointment. And our problem statement is that time required to complete new patient forms cuts into the allotted time for the new patient exam. So some of the metrics that we found before we started going into our PDSA were we kind of timed to see how long it took patients to come in and complete the paperwork here. So it was taking them around 20 minutes to complete their paperwork. So you can imagine most patients come here on time and then they get lost, so then we're starting our new patient appointment 20 minutes late. This is our driver diagram. So our biggest aim was to increase the quality of care by maximizing the provider-patient time at each appointment. Primary driver to accomplish this was to have reliable processes for completing registrations for new patients. Two of the secondary drivers that we came up with were providing the new patients with their forms before their appointment, or to require them to come 20 minutes early to complete this. Some of the actions or interventions for both of the drivers. For the top part, it would be to delegate to the front desk that they need to obtain, as well as mail the new patient forms. And then for the one on the bottom, have stricter late policies where the patient is not seen if they don't arrive at the appointed time, or have the providers start their appointment before the forms are completed, which is not ideal. So solving the new patient tardy appointment issue. As I've been saying, our idea was to mail the new patient forms and then have them complete them before their new patient appointment. So this is our process map for the process. So basically, most of this falls on the front desk, being able to, as they're making the new patient appointment, asking for the emails so that they can then send the email. And then after they send the email, Esme or whoever would be doing this would write on the Axiom a little pop-up saying that they had their new patient forms sent to them. If they say no, if the patient doesn't have an email or would not like to do their new patient forms at home, then have them come early. So that way the patient would be ready at the appointed time, and then we can see them at their appointed time. This is our PDSA. It's kind of heavy. I took into account what you guys were saying last night. So the plan was between January 23rd to the 31st, we would have Westwood email patients who had emails and who wanted to get their new patient forms emailed to them before their appointment. Then they would bring them to the appointment. We had a total of 5 patients do this, all of which were identified on Axiom with pop-ups. Esme would tell us if the patient had their forms with them. What else? The way that we measured when the patients checked in, so Esme has a check-in sheet where the new patients would check in. They would actually write their names in and the times that they checked in. She wouldn't check in the patient on Axiom until they had their forms ready, and then we as providers would check them in on Axiom, so we had documentation of all 3 times. And then the study, we had a total N of 21 for the week study. On average, new patients who completed the forms when they came to the clinic were seen 12 minutes after their appointed time, and all the patients who brought their paperwork were seen on time. And things that we want to do acting in the future is to continue doing emailing the new patient forms and maybe trying to mail them, and continue having the front desk help us with this.
Okay, to summarize our metrics, so with all the new patient forms that were completed in clinic, there were 16 of them. And once again, Jen kind of went over this earlier. It took them about 20 minutes to complete it. On an average, they sat down 12 minutes late. And the ones that were emailed on time, they came on time and they sat right on time. So the effects of failure. So first one, time spent filling out the questionnaire extends into the allotted appointment time. People can't really expect how many questions, how in-depth these questionnaires are, and that affects the tardiness for the scheduled appointments, and rarely you may have to reschedule the patient if they do come late and if they do have to fill out a form. Some of the barriers to success includes from the patient end. Some of their responses are if they're unable to receive the emails because they don't have a printer or they don't have email or simply they don't have computer access or knowledge. And from our end, it does take an additional time to send out, jot down their emails, put in a pop-up note, and to actually go on Gmail and actually send it out. And so this doesn't really apply towards everybody because patients can't really call into the clinic and we give them an appointment the next day, so we can't really mail forms out to patients who are requesting an appointment within like a week or 2. So that's another problem that we encountered as well.
Yeah, and then, at our Venice clinic, they mentioned that I guess the courier only comes 3 days a week. So if you make an appointment on a certain day, you might not be able to mail out things until like 3, 4, 5 days later because it has to come to Westwood first. So they were really hesitant about the whole mailing thing. I guess you can't mail out of there. And then the front desk.
Funny.
Yeah.
Very fun, isn't it?
And then the front desk at Venice were very adamant about not having time to do this, so we didn't really do it in Venice. We just did it here.
Yeah, so it seems like the turnaround time would be at least 2 weeks to mail it out and for us to receive the mail back, or if they want to come back in with the printed paper. Question?